Welcome, welcome. Namaskar, namaskar. You are welcome to a new Facebook Live with Ayushakti Ayurved. My name is Krishna Pankaj Naram. I'm the son of Dr. Naram. So, namaskar, namaskar from my father, Dr. Naram, as well. And the son of Dr. Smita Naram, who is also with us on this live call. Today, we will be talking about proven ancient solutions for sciatica and back pain. And these solutions, which have given to lasting relief in the last more than 30 years to people from more than 108 countries, which was 9 out of 10 people. Today, I'm particularly excited because with us is a man I respect and love from my heart deeply. He is, let me read out because this is pretty interesting. He's a chiropractic physician practicing in Raleigh, North Carolina, and he's been practicing Ayurveda and chiropractic since the last 23 years. Now, since the last 23 years, he's been practicing, but since 2001, he's with Ayushakti, and Ayushakti and him working together to help more and more people. I can tell you one incident which I have experienced when he was in Mumbai at our house. I was having some kind of a discomfort. I couldn't tell exactly what's happening in my body, but then he saw me and then somehow he told me that, are you having some discomfort? We went down. We have one place where we can lie down and do massage and this and that. So I laid down on that bed, and then he held my shoulder, did something, and then did some sudden chiropractic adjustment, like this, and then I stand up. I don't know what happened, but suddenly there was a new flow of energy and I started feeling more balanced and more enthusiastic. I don't know how that happened. And maybe that's why hundreds of patients come to him every month, and he's super busy. So I'm very grateful that Dr. Mitchell has found time today to share with us these solutions, and Dr. Smita Naram, also super busy. My mother has found time to share with us these solutions, which can really help us deeply. Before we continue, an announcement. Couple of weeks back, there's one special herbal supplement from Ayushakti called D-Viro, and sadly it went out of stock. It came, but then there was a lot of confusion and a lot of questions by many people that what do we take for immunity? What do we do? We were getting really confused because now there's no staff coming and we are at a loss of how do we help all the patients. So then Dr. Smita Naram, my mom and couple of other doctors got together, compiled a immunity kit so that all the confusion was lesser and many people can be helped. Finally, that immunity kit is ready, and you can see on Facebook, social media, and discover more about it. Now comes the big time of introducing my mother, Dr. Smita Naram, who will share with you these proven ancient solutions with Dr. Mitchell, Dr. Thomas Mitchell. Welcome, welcome. Namaskar, namaskar.
Namaskar.
Namaskar, namaskar, namaskar. I'm so happy. First of all, that one of my very, very dear colleague is here today with us, Dr. Mitchell. He's so super busy. It is difficult to get him on call like that. So I am happy. We are actually associated for more than 19 years now with Ayushakti. He started actually learning pulse reading from both of us, me and my late husband, Dr. Naram, both of us, and he practiced Ayurveda very successfully. Really, he has such a great experience. So today, my dear friends, stay with us all the time because you will actually get to know a lot of tips which will be really helpful to relieve your pain kind of instantly. If you suffer from any back pain, sciatica, or anything like that. Plus, if you have a very chronic situation, then I would definitely recommend that you come and see our doctors. So we will be sharing numbers with you, and this time, we are giving free consultations, so you can definitely take advantage of that. We would like to help humanity at this difficult time of our earth. So let's start about back pain. Basically, um, I have seen so many people, and people can't walk, they limp. Actually, myself, I had sciatica 2 years ago. You remember, Dr. Mitchell, I came to your place and you did some adjustment at that time. I, I remember
Yes.
that yeah, and I felt good actually, but it came back in just 3 days again because I was running and jumping all over US at that time and not resting ideally. So obviously my alignment went off again and came back home and started really treatments, a detox program and herbal formulas. And just in few months, I was completely fixed and I'm back to jumping and dancing again as usual as before. And that's, my age is 58, but I can do a lot because of Ayurveda. I have ability to do a lot of exercises. So those are the secrets that we will be sharing with you today from this ancient knowledge, the solutions which are proven as per Ayushakti's experience and from the old books. But let's watch today this special case that I have actually, we all of us together at Ayushakti treated in year 1999 when we started Ayushakti clinic. Dominic came and she told me that basically she was a singer, but she couldn't anymore because she had this very deviated spine and she couldn't walk, and the pain was so excruciating that at some point she couldn't even walk and go up to the pharmacy to get a painkiller. It was so difficult. And then one of Ayush Shakti's clinic partner in UK actually treated her for a few months with herbs and she felt very good. And then they said, okay, now you have to go to India and meet the Narams, both of us, me and my husband, in Ayushakti clinic and stay there. And she did that. So let's watch what she says.
I'm Dominique. I first discovered Ayushakti 20 years ago when I had developed a spontaneous scoliosis, which had made my spine deviate quite severely to the left. And I had very severe sciatic pain, for which I was taking a lot of strong painkillers. In the UK, the doctors wanted to cut and fuse my spine, and I felt in my heart that this was not the way that I wanted to go. And a friend who was studying with the Narams suggested that I come to India for a 6-week Panchkarma treatment. Within 6 weeks of coming here and going on the diet and taking the herbs and having the treatments, my spine was completely straight. And over the next year, I continued with the food and with the herbs and treatments, and all my pain went away. So from then on, I was extremely healthy, and I kept on coming back every 3 or 4 years to have a Panchkarma just to maintain my health.
So that was Dominique, and I'm so thankful that she shared this experience, you know, uh, with us today. I want to invite Dr. Mitchell to share what are the causes, symptoms, what have you seen in your clinical practice practically, how people can know that they are suffering from sciatica or that kind of a situation.
Thank you, Smita. It's such a pleasure to be here today and to be with you. Yeah. So we're talking about two different things today. One is low back pain and one is sciatica. So there's some different symptoms with those two things. Symptoms of low back pain is more of a dull, aching pain and stiffness in the lower back region. And there's pain with movement, and typically you'll find muscle spasms. So these are the symptoms of low back pain, and we can go to the next slide now. So symptoms of sciatica are a little bit different. You still have the pain, but the pain is a sharp and shooting pain or a burning pain typically. And you can have numbness and tingling in the legs and the hip. Can start in the low back, go down through the hip and through the thigh, leg, even all the way down to the foot. So these, and then you can have the like I said, the sharp shooting pain, burning pain. So these are the symptoms of sciatica. So it's a little bit different. The two types of problems have somewhat different symptoms, although there are both some quite severe pain. So we can go to the next slide. Yeah, so then if the sciatica becomes even more severe, you can actually get weakness in the leg. And with sciatica, the difference between sciatica and low back pain is with sciatica, typically it's aggravated by sitting, because when we sit, the amount of pressure on the disc is 3 times what it is when we're standing. And with kind of just basic lower back pain, you'll get pain with movement. So causes of lower back pain could be injury, strain or sprain. A strain is when a muscle is stretched beyond its normal length, but it's not torn. And a sprain is when the muscle is stretched beyond its normal length and there's actually some tearing. So that's a sprain. And then sometimes if we don't exercise, the muscles become weak. A misalignment of the spinal vertebra can cause lower back pain, and just repetitive motions also. Next slide. And then also poor posture is a big issue, especially for those of us who are working on the computer a lot. We'll get poor posture. So it's very important to have good ergonomics when we're working on the computer. Very critical. So then we can, next slide. And then causes of sciatica. So there's 2 major causes of sciatica. One, and they can both exist at the same time, but sciatica is caused by pressure on a spinal nerve. The first issue, the most common issue, is from a bulging or herniated discs. So the discs themselves are active shock absorbers in between the spine, in between the vertebra, and the outside of the disc is very hard and fibrous, and inside the disc is a gel-like material that acts as a shock absorber. So with wear and tear, which from an Ayurvedic standpoint we would call increase in vata, you get some cracking or splitting of the outside ring of the disc, and you can get some bulging or herniation of the disc material. Then disc material then sits on top of the nerve root and causes this radiating pain down into the leg. The other thing that can happen with increase in vata is you can get degenerative changes in the spinal vertebra. So you can actually get what are called osteophytes, which are bony changes, bony outgrowth that can actually press in on the nerve roots. And so this is a more severe, difficult to deal with condition, but these are the 2 basic causes of sciatica. And then there's we talked about the causes of low back pain as well. So.
Yeah, that was really fantastic, Dr. Mitchell. You also explained what happens from Ayurvedic point of view, and that is so correct. When vata increases, vata is so degenerating that it reduces the disc space basically, and also it can also, yeah, that's great, thank you. So it can actually also create inflammation or tear, which you said so correctly, because of vata, and the disc can get inflamed and also bulge out from the inflammation. So that's ama symptom, and Ayushakti's approach is fundamentally to reduce this vata, because vata is drying, like in the atmosphere, when there is too much air, everything dries up, the leaves start falling off, you feel dryness on your skin. Exactly, when you have a lot of gas, air, which is like vata, we call it, in your body, it dries up things and it cracks things, and that's how we get this degeneration in the back. Along with that, when there is ama is inflammation causing. So Ayushakti's approach is reduce this vata, reduce ama using diet, lifestyle, home remedies, some detox programs and herbal formulas. We call it Arthrox actually, but and Arthrox is proven now as per international research papers to be very, very effective to repair bone injuries and degenerations in the bony structure. And along with that, we nourish. So Arthro contains the removal of balancing of Vata Ama, and also nourishing finally the bones and the nerve tissues which have been damaged from this impact of Vata. So that's what it is. And you know, my friends, we have so many clinics across the world, so many clinics across the world, and don't feel shy. Grab your opportunity to get truly healthy, getting long lasting health. Here are some phone numbers. We have like almost 150 clinic partners all over the world. You can just call us and we will guide you where you can find the closest clinic partner in your area. You can do a video consultation. You can get in touch with WhatsApp or email, etc. We have been actually getting a lot of mails. I'm so happy and feeling loved since we started this FB lives actually every day. And if you have any questions or comments, please put it in comment section. We will be taking live questions after this, definitely. So I would like to actually invite Dr. Mitchell to talk about the diet plan, what we do in Ayushakti. And
Thank you, Dr. Smita. Yeah. Thank you. So from a food standpoint, what it's important to do is to eat foods that are light and easy to digest and have a nourishing effect. Things like mung dal, either whole mung dal, split mung dal, green vegetables are all very important because they're very nourishing and they help to reduce inflammation and keep Vata under control. All those things are good. Next slide. And so these foods, like I said, green vegetables, also sweet, juicy fruits, and warm soups and stews, foods that don't contain gluten, mung beans, red lentils. For people who are not vegetarian, they can have chicken and turkey and fish. So the foods to avoid, the foods that we want to avoid are heavy, hard to digest foods. So for example, wheat, grains that contain gluten are heavy, hard to digest. Milk and dairy products are heavy and hard to digest. Cold drinks reduce the digestive fire, make it more difficult to digest foods. Cold foods increase Vata. And then stale foods like canned foods and packaged foods, processed foods, red meat, very sour foods like tomatoes and citrus fruits, dry foods like crackers and chips. All these things will increase Vata, increase inflammation. Refined sugar is another issue, and fried foods and also chilies will tend to aggravate these issues too as well. So exercises, the exercises that are appropriate when people are experiencing low back pain or sciatica are non-impact exercises such as walking, swimming. Also stationary biking would be okay, but again, when people have sciatica, it can be difficult to tolerate sitting. So it may be better for walking may be a better exercise, but people with straightforward low back pain probably can tolerate some stationary biking. The swimming is excellent exercise also. Next slide.
Yeah, these are some of the asanas which people can do. And for example, Balasana, the child pose, can relax a little bit, pinching of the nerve. Okay, and the next one. Yeah. Or Sukta Kopatasana, which is like a reclined pigeon pose or half moon pose. Next one. Yeah. Or lotus pose, Salbhasana, which is very, very known, as you know, or bridge pose is relaxing your nerve, because when the nerve stops touching the disc and nerve, they don't touch each other, you feel a bit relaxed. But it's not healing exactly, but it can relieve for a while. Yeah. Next one. And these are something we should avoid completely when you have this trouble, because it can aggravate. So downward, anything which is forward bending asana, like downward facing dog or chair pose or something like that, or Surya Namaskar, this kind of a thing, this Janu Sirsasana or seated forward position, these are to be avoided till you really get settled in your sciatica situation, or it gets healed completely. Yeah. And these are actually some of the home remedies. And in India, we call it a ladu, which is a round ball that you can, it's like a sweet thing you eat in the morning. And if you don't want to eat sugar or jaggery, then you can just mix everything together and take a spoonful of it. So I'll explain to you what to do. So you take like 1 tablespoon of fenugreek powder, then you take half cup of jaggery, you take dill seed, actually around, I tell you how much, dill seed would be like 1/4 of a cup. Dill seed is actually ajwain seed. I prefer ajwain seed than dill seed. So 1/4 of a cup. Ginger powder, not fresh ginger, but ginger powder, 1/4 of a cup. And take ghee around 1/4 of a cup. So, and add some jaggery so you can bind it all together completely. And this mixture, what you can do is you can actually make enough so it can bind, and make a round ball of like 1 inch size, and just keep it in a jar, and you can eat 1 ball in the morning. So if you don't want to take jaggery because you are overweight or there is a sugar problem or something, then just avoid it and take a tablespoon of this mixture in the morning. Just mix it with ghee and just keep it bottled, and just you can take it all together in the morning. And at night before going to bed, this is absolutely quite amazing, effective, basically formula for your back, and you can use it very safely, constantly, no problem. Yeah. And so what's the next slide? Okay, Dr. Yeah, you want to take this, Dr. Mitchell?
Yes. So two of the primary herbs that are very effective are for back pain and for sciatica are Pain Mukti MJ. Pain Mukti MJ is anti-inflammatory. It has herbs in it that have an work to reduce inflammation, but without causing any side effects at all. Pain Mukti Sandical is very helpful for when there's been an injury. It's very nourishing to the bones, and it actually helps to support bone density as well. So these two things together are very effective combination for low back pain and for sciatica.
Yeah,
and
wonderful.
Next.
Thanks. That was great. Yeah.
Now, Dr. Smith, if you'd like, I can share one of the experiences I've had recently.
That would be great, actually. Yeah.
Yeah.
That would be great, really.
Yeah, I had a patient recently with very severe sciatica. He could barely walk into the office. I saw him getting out of his car, coming into the office from the parking lot, could barely walk.
Wow.
He had burning pain down the back of his leg, sciatic pain all the way down into his foot. This is very severe sciatica when it goes down that far into the foot. And so I started treating him. In my office, I use chiropractic, but also Ayushakti herbs. So I use the Pain Mukti Sandical, Pain Mukti MJ. I use some other things as well since his pain was so severe. But over the course actually of a couple weeks, his pain level, we do a pain level scale rating on a scale of 0 to 10. Well, 0 is no pain, 10 is the worst pain you can imagine. And so his pain level was 10 when he came in. And after just a couple of weeks, his pain level was down to 3 or 4. And the pain was not radiating any longer down into his leg. It was more localized in the low back. He was very happy because he was trying to get better before he got on an airplane to fly to India to visit his family. This is last fall before the virus struck. But,
wow, that's really great.
Yeah, very, very good result. He was very happy.
Yeah. That's amazing.
So it can be managed. And as Krishna was saying, what I see using the herbs and these natural therapies, the home remedies, and the exercises really over a 90% success rate with sciatica, which is difficult, much more difficult to correct than just straightforward low back pain. Very high success rate with nearly 100% with straightforward low back pain, over 90% with sciatica. So very high success rate.
Wow, great. Thank you. That was really wonderful. And I think and people get long lasting relief. That's the main advantage. They don't have to remain dependent on these things forever. The relief stays longer for many, many years until there is new injury or something.
Yes, absolutely. Yes, they get long-lasting relief, and they don't become dependent upon the prescription, the addictive prescription pain medications. They aren't subject to the side effects that people get from the prescription medications for these, which really only give temporary relief anyway. So, yeah.
So that's what I want to tell all my dear friends. You know, Dr. Mitchell said that he gave also something extra because of his great pain, and that's why you have to give sometimes extra herbal formulas based on what is your situation. So we have shared everything which is like general, but I think if you feel free to consult us. We are going to share his number here as well. You can call him from any part of the world to take his advice, or you can call us, write to us. Anything is fine. But you know, we are just one email or call away. And don't try and do the self medication. I mean, it would be always great to have a personal consultation, especially in a very chronic severe conditions.
Yes, chronic severe conditions, it's important to have professional advice.
Exactly.
Yeah.
Yeah.
Thank you, Dr. Smita and Dr. Mitchel, for joining today and sharing such a beautiful information on sciatica and lower back pain. I am sure I will share this video with all of my colleagues, all of my friends, all of my family members who are right now at home and they're working from home. And I am pretty sure I have got hundreds of messages on this Ayushakti page. Like people are going through back pain. They're sitting at home. They don't have an office desk at home. So they're going through lower back pain. I am sure that this video will help them a lot. So before we jump into questions, I would like to ask Dr. Thomas. You are with us from past 19 years with Ayushakti. So where have you seen the result as a client personally?
Thank you. Yes, I am so happy to have been associated with Ayushakti, and I see results with many different kinds of conditions. For example, respiratory conditions, asthma, bronchitis, pneumonia, digestive problems, different pains in different parts of the body, different types of autoimmune conditions, conditions that affect the nervous system, anxiety, depression, all these things. Very, very excellent results over time.
Wonderful.
Dr. Smita, would you like to share some of your tips for the viewers?
Yeah, we just shared so many tips in this whole recordings. I just want to tell my all dear friends that we have been getting so many messages from all of you. You people are posting your comments, asking questions. This is such a great feeling. We feel that you are really loving us, and we would like to keep sharing it more and more. So please write to us what you want us to know. There was somebody who wrote to me that we would like to know about how to deal with the dry hair. So I just posted a dry hair tips yesterday on a static post, and that was absolutely dedicated to this special person from Canada. So I just want that please, all of you, take advantage of us and write to us so that we know what you want us to talk about. And we'll come with those topics again and again. And put your comments in the comment box. And if you have any chronic health situations, don't self-medicate. Take advice of our doctors, because Ayushakti doctors are really, really trained and they are very, very excellent in their work. And I see you later. I really love you so much, all of you.
Thank you, Doctor. let's get into the question answer session. So the very first question is: are old people at a greater risk of suffering from sciatica pain?
That's a very good question. Actually, sciatica can happen at any age, but what the studies show is that there's actually a greater risk of sciatica between the ages of 20 and 40 because the discs are healthy and there's more disc material. And if the discs become injured or they degenerate at that age, then there's actually the more common incidence of sciatica at the younger age, between 20 to 40. It's actually less common with older people, right, although you do see it with older people. So.
All right. There is one more question. Can sciatica cause paralysis if left untreated? Can sciatica cause paralysis if left untreated?
Yeah, that's a good question. If it becomes, there are situations where sciatica can become an emergency situation. And if there is loss of function of the bowels, or loss of function of bladder, then it's an emergency situation and you need to go to the emergency room and get medical treatment. But there is, it would be extremely unusual that sciatica would cause paralysis. It can cause weakness of the leg, but what used to be thought was that that the injury to the nerve was permanent, but it's now understood that the injury to the nerve can recover. It may take some time for the nerve to recover, to regain function again, but paralysis would be not expected with sciatica.
Great.
All right. Dr. Smita, there is one question for you. Can sleeping position affect sciatica pain?
I think it is two ways. This is also a more answer good for Dr. Mitchel, I think, because he's so specialized in he's a chiropractic physician. So I would request him to actually maybe respond to this question.
Okay, and the question is about sleeping position?
Yeah.
Yeah. So sleeping position, the best sleeping positions are either on the back or on the side. And it injures, it's not good for the spine to sleep on the stomach. So if you're sleeping on the stomach, this will cause additional problems. So the best positions to sleep, and either of these are okay, is sleeping on the back or sleeping on either side. Those are fine. And you may find it helpful also to have a pillow under the leg to support, if you're sleeping on the side, have the pillow under the knee that's bent to help support that. That may take some pressure off the spine. You can experiment with some pillows under the knees, under the legs while you're sleeping to see what makes you more comfortable.
All right, doctor. There is one more question. How can I relax my back muscles quickly? How can I relax my back muscles quickly?
Yeah, so we actually shared some of the yoga postures, and normally I have seen that if people do those, like I went through sciatica myself, actually it was quite severe, and whenever I did those postures I felt relaxed immediately. So I would recommend you can try them.
Yes, and for muscle spasms, heat is very relaxing for the muscles. So vata, exactly. We talked about vata. Vata is cold in nature.
Yeah.
So we apply the opposite, which is heat, and moist heat is better. So like a heat pack with a sponge or something that's moist is very relaxing for the muscles, very helpful. A nice warm bath can be really very helpful too.
Yeah, in the clinic we do Pindaswet, which is a hot fermentation. You
yes.
also have started doing in your clinic as well, so that's
yes.
relaxing too. Yeah, wonderful. Thank you.
All right, there is one more question. I have a hump look alike on my neck. What can be done to get rid of it? It is painful sometimes.
I'm sorry, I didn't hear. There's a hump on the neck?
Yeah, I have a hump look alike on my neck. What can be done to get rid of it?
Okay, I would say in that case, it would be important to see someone and be examined and to understand what exactly is happening. But one of the things that can happen is you can get there's a normal curvature in the spine. So there's a curvature in the lower back. You'll see in the curve there's a different type of curve in the mid back, and then the spine curves in a different direction in the neck. So sometimes you can get reversal of that curvature, and you'll see what looks like a hump. But in that case, there can be a number of different causes, contributing factors to that, and so it'd be good to be examined and allow someone to take the history, check the pulse, and to do a more detailed analysis to figure out what the cause is.
Yeah, and I've seen actually many people, depending on what the cause is, can get rid of it, but not all, but yes, many of them. Yes.
Mm-hmm. Yes.
All right.
Yes.
All right, Dr. Mitchel, there is one comment in a comment box. Her name is Galia. She says, I have been treated by Dr. Mitchel for knee pain with supplements and herbs. I was cured. Thank you so much.
Oh, wonderful.
That's
yeah, wonderful.
great. Somebody,
Yeah.
some of your client is there. Wow.
Very nice. Yeah.
Yeah. So we have answered almost each and every question, but our viewers will, I am sure they will send more and more queries in the comment box below, and I will answer, our doctors will answer that. So I just quickly want all my viewers to know that please share this video with your friends and family who are dealing with this or going through this. And I also want to know that Ayushakti's doctor are available on phone and video consultation as well, and we are giving free phone consultation. And if you want to get connected to Dr. Thomas, these are the details on the screen as shown on the screen. You can quickly take a screenshot of this and you can contact him on the telephone number given on the screen. Yes, and I want you all to know that Ayushakti clinic partners are offering free phone consultation in Germany, UK, and Europe, Netherlands, Belgium, Italy, USA, and Australia. The toll-free number is 1-800-2800-906. I repeat, it's 1-800-2800-906. If you're calling from any Indian country, you can call us on 1-800-266-3001. Or if you're calling from any global country, you can call us on 1-800-2800-906. You can even WhatsApp us on 7777001561, or you can email us at info@ayushakti.com. Ayushakti doctors are available on phone and video consultation as well. Thank you for joining us today. Namaskar.
Namaskar.